Hey everybody, it's Andrew Malkoski with the Denver 100 here, and I am hanging out with Christina Hoffeld again. Christina is with Hoff House Health and is a health insurance rep. And we were talking earlier about the services, especially on the individual side, but you also work with businesses.
Yeah,
Helping the businesses provide the coverage to their employees.
correct.
That's a little bit different. Tell us about it.
Well, yeah, it's a lot different.
Yeah.
And it's different because now you've got multiple people with varying needs, and
Okay.
then the business owner we're generously asking for them to incur an added expense. One of the things that is it's an underserved market because you've got traditional group benefits that you have to have at 50 employees and up. And those plans can be very expensive for those businesses that are 20 people, 10 people. But if the business owner wants to provide a service, they also understand that this helps create longevity within their business and their employees, lack of turnover. Then what happens is that's where I come in, because I can work with those smaller groups and figure out a way, because it's not one size fits all, that's going to work best for that business, the owner, and their employees. And so I can get really creative, which is also kind of cool. I also have referral partners if it's something that becomes too big for me. I have wonderful referral partners that can do that, like I said, that small middle size, right? So I think anything under 50 is small. I mean, 50 people still considered a small business, but in the world of health insurance, that's where the requirements to provide coverage begin for the business owner. And so I just want people to be strategic. And, quite frankly, mom and pops are the backbone of this country.
Yes.
And so I think they should be here. I think they should feel supported in being able to stay solvent. Well, one of the ways to do that is to reduce turnover.
Right.
On average, depending on the business size, it could be $3,000 to $9,000 per employee when turnover happens.
Yeah.
And then when you look at what you're going to spend annually on a health insurance policy, a lot of times it's less than that for those smaller businesses per person. And so they're saving money, even though they're incurring a cost overall. When you're really looking strategically, you're taking the emotion out, right? And you're just looking at the numbers. It can be wildly impactful to that business. The other thing is there are some tax benefits to some of this. So, yeah.
Well, that's cool. I did not know that.
Yeah. So, and there, I don't. There's too much minutia to get into here, but yeah, there are lots of ways, again, where we can create strategies to make sure that the business is taking advantage of those tax savings, but also providing those health benefits to their people. So, yeah.
One of the challenges you had just mentioned there was that you have now a group of people who may have varying needs. I am sure that it is not easy to answer, like, how to do this in every situation, but how do you go about trying to balance that out? I mean, that seems like it would be incredibly difficult.
So similar to you in what you do, I know, because you're so experienced, you can take a look at a neighborhood and you have a general understanding of what these homes should cost. And then you get into the minutia by finishes, lot size, where they're appointed in the neighborhood to get a really great understanding of where price should be. Well, similar in health insurance, right?
Okay.
There are things, it's called a census, so you get general information, age, really superficial health history, height, weight. Those little things, in my expertise, give me an understanding of where we need to navigate for everybody.
Wow.
Yeah, it's kind of cool, right?
Yeah, that is cool.
And then you can get further down the line. Hey, what medications are you on?
Yeah.
And then that gives me a deeper insight into how we need to navigate. And so exactly, it's just your long-term knowledge within the field allows you to kind of cut and paste really quickly similar to what
Very
you do.
interesting.
So yeah, it's kind of cool.
Very nice.
Yeah.
Well, if you work with somebody or you know anybody that does have a small, medium-sized business that needs that help for their employees,
Yeah.
my friend Christina is very good at this, and reach out. Thanks a whole lot for being here. We're going to have one more conversation on the next episode, so hopefully we'll see you then. Thanks.
Thanks for having me, Andrew.